Welcome to Psychologist Talks. This is going to be part 4 in a series about dependency and dependent personality disorder, and today we are talking all about treatment. Now, with anything treatment related, none of what I'm about to say constitutes medical advice, so please do not take it as much. What I'm going to be talking about is, in general, what do we pay attention to in treatment, and what does treatment possibly look like? These episodes are usually gauged a little bit more towards providers because there's a lot of nuance in how we do personality-related work, and that's why I always encourage consultation, because anything I say today is not going to be terribly individualized, just kind of general concepts. So consultation is key. If you're a potential consumer, a client who maybe has been diagnosed with dependent personality disorder, I hope it's just kind of helpful to hear somebody talk through it, and I'll periodically try to, perspective take for the, what it would be like as a client listening to this. So we're going to talk about a few things. First is countertransference. Countertransference is one of the most important ways to identify when a dependent process is going on, and it's a little bit tricky for dependent personality disorder compared to other personality disorders. Countertransference, I think, is a little bit cleaner. Why? Because we're in the helping profession. Dependent personality disorder is notorious for legitimately seeking help and frequently seeking help. Then we'll talk a little bit about gender dynamics, and this might be a little bit dicey to go into, but I think it's very important because there's a dialectic, there's a both and. Two things can be true at the same time that we need to be careful of in this profession. And then last but not least, what's the gist here? What's this process going to look like, and what are you aiming for in treatment? So, first things first, countertransference. The first countertransference for most providers is going to be compassion and care and nurturance. And, I already alluded to it. These folks with dependent personality disorder, they frequently come in for help. They recognize that there's some sort of distress or dismay that's going on in their life. They might not identify the dependent pattern as the problem, but they will very legitimately have all sorts of symptoms associated with the condition, often anxiety and often depression, and they are going to reach out for help about that, which yields compassion. On top of that, the tragic story for a lot of individuals with dependent personality disorder is they find their way into unhealthy relationships, invalidating, and even in many cases abusive relationships because of their passivity and lack of willingness to hold boundaries and hold themselves with a sufficient degree of esteem. And so very naturally in the helping profession, there is this pull, this emotional reaction to care for, nurture, and have a lot of sympathy and compassion for them. Now, over time, that countertransference begins to shift. This is not to say that compassion dies, and so if you're a client or a prospective client listening to this, this could get a little bit dicey sounding, but I promise you there's utility and there's a both and here, that we can be both compassionate and increasingly the change in countertransference is towards frustration. Because this sort of lack of gumption and desire to affect change in their life, this sort of unwillingness to move unless there's an assured positive outcome, or this over-reliance upon the input of other people. Frustratingly so often as a provider, it sounds like you're on the right track, and then they hear something from somebody else, or they just delegitimize or out of fear move away from that potential movement, and it just begins to rub. It creates a rub on providers. It's just increasingly frustrating. Like, come on, you've got to be kidding me. We're doing this again. We've been through this 20 times. Like, can the 21st time stick a little bit? Again, that might sound a little demeaning, but it is a very real and very important countertransference. Why? Well, it's usually not about the provider. That is a reaction that most generally healthily attached people are going to have in response to dependent personality disorder, which is full circle why they often find their way into more unhealthy versus healthy relationships. Healthier attached individuals tend not to respond positively to high levels of dependency over time because it creates an inequity that is very uncomfortable for them. They do not like to be relied upon. They do not like to feel constantly powerful, and that the other person is not kind of rising to the occasion, and it will wear on the relationship until they leave, or it severely compromises or jeopardizes the relationship. Now, neurotic, higher level functioning folks, that, those relationships can usually do okay, and it's more of just kind of like a rub in the relationship, but it is at the detriment of a healthy relationship. And that's what often has them landing, because they've got to be with somebody. They end up with the not so healthy relationship, who will consciously or unconsciously use this passivity and use this tendency to acquiesce at all costs to their advantage. And so, full circle, this countertransference reaction is important for a provider to realize, because it's indicative of something's going on relationally as a provider with your client, that is going to replicate itself somewhere else. And us relational psychodynamic people say, you use that. You're not supposed to just ignore that and act like nothing's going on. And so there's something to do with that information. So hopefully that, one, assuages any anxieties or fears of being invalidating as a provider. That frustration is both legitimate and replicates itself outside the room. And if you are a client, hopefully that both end makes some sense. They can still care for you and be compassionate about your experiences, yet simultaneously experience very real frustration because of the defense matrix that you tend to respond to, that dependency, that fear. The lack of sense of self independent of other people, that frustration is supposed to be there. It's supposed to be there. So that's the countertransference piece. I think it's tough for a lot of providers because we're in the helping profession, and there's still this, it's wild to me, there's still this stigma around, I think being pushy, or like the fear of like you're being pushy or you're dictating to them, and because of their passivity and frailty, you don't want to push too hard. But if you don't push, they will not get better. If you're their client, you will not get better if you're not pushed. And so there's this tension that will be created by virtue of pushing, and that tension is necessary. And us in the helping profession, it's like, well, we want our clients to feel good coming to see us. Well, welcome again to personality work. There is frequently discomfort, if not necessary discomfort, anytime you challenge a defense. Anytime you challenge the defense, or sort of the quote-unquote Gregory Lester's drama of the personality disorder, you're going to get conflict, and that's necessary to confront and work through. Now, what's this gender dynamic that I was talking about? Well, in the development episode, we spoke a little bit, or was it the development episode, or was it, no, I think it was the one before that, wow, brain is dying. One of my earlier episodes, it was talking about gender, and it's a skew towards women. And there's a huge gender socialization component to this. I know in the last episode I talked about culture and how culture shapes our notions of dependency. Well, you better believe there's a gender component to that cultural overarching, thing too. And so we have needed to be more diligent in over-identifying dependency in women. And with this sort of second wave of feminism that's coming back around, there is both a good progressive ideology and a dangerous overextension that could be occurring. What do I mean by this? On the positive side, we have to understand that women can show up in a more dependent manner, more secondary to their experiences and expectations put upon them than it is something naturally intrinsically ingrained in their personality. That if given sufficient permission, particularly from like a feminist treatment point of view, to emancipate themselves from these tendencies, from patriarchal systems, it'll disappear. They won't, not without their struggle, right? But there will be this like growing, oh, okay, I have power, I have say. And once they get that fire lit, they're off, right? And that's not dependent personality disorder. That is more of a construct created by culture and society and expectations that they've just lived their entire life. However, we need to be careful not to assume this is the case all the time. And I see this a lot. We still to this day, we will project onto women that they're just trapped in their current circumstances, that it must be the greater system and the greater culture that is creating their problems, because the inadvertent monolithic ideology here is all women are inherently, ironically, non-feministically, if that's even a word, are victims of their greater systems. To which I would go, they are human beings. And just like us men and anybody in between, we got personalities. And if we do not sufficiently identify legitimate dependency issues that indeed are influenced by culture and situation and experiences, they're not going to get better. That you cannot empower someone and just positivity feminize somebody out of a dependent position. It's not going to work. Or if it does, it's going to be the massive passage of time. You're going to be sitting there for 5 years with this individual constantly trying to reinforce a sense of empowerment. And so we do need to be careful. We need to give that latitude that there could be contextual cultural variables that very quickly, if given permission and perspective, they can emancipate themselves from. However, if there is a heavy resistance to this and this gravitational pull in the room, including with you, especially this is why you as a provider are an important tuning fork. If they have this constant passive dependency and over-reliance upon you and everybody else, and it just chronically goes that way, and you're pulling out your hair because they keep going back to it, you're probably dealing with a dependent personality disorder. You can still take a feminist approach to that, but you need to add in a personality-informed component of your intervention. You cannot simply rely on empowerment and emancipation from patriarchal systems to make things better. Never mind, we need to get better at identifying this in men. We simply do not do a great job because personality is frequently split conceptually down gender lines. And we've neglected this field quite a bit, and we need to learn to differentiate. That's not an anti-feminist thing to say. It is an important thing for their growth to actually really truly identify and not be like, well, I'm just victim blaming because I'm labeling dependency. No, you're labeling a serious issue even if they have indeed been a victim of their circumstances. It is a dialectical both end, going back to this idea that they are in many ways a victim of their circumstances, but they collude with the systems and they gravitationally, unconsciously, pull themselves back into scenarios of dependency that keep them in disempowered positions. There has to be personal responsibility in addition to an appreciation for the context and the history that makes up and continues to perpetuate the dependency issues. So hopefully that makes sense. Hopefully that did not insult too much, but it irks me a lot. I've seen this a lot in interns and students and young clinicians, that there's just like an abandonment of this issue completely under the false notion that that's a feminist approach. The feminist approach does not say you treat women in particular with potential dependency as though dependency no longer exists. It is a thing. It is a thing that any human being can experience, and we need to treat it as such and discern balance between contextual variables versus truly ingrained personality issues. All right, now I'm just repeating myself. I just get nervous, right? This is like a one-sided endeavor. People can get all mad and do whatever they want on social media. So I say these things with great care and caution. Hopefully it makes sense. All right, so what are we actually doing in treatment? Well, I mean, it's probably obvious enough. You're trying to confront the dependency and increase independence, but how do you do that? How do you do that? Especially if you just told me that empowerment's not going to work by itself. Well, I think one of the things that, again, trips providers up, if they are willing enough to just say that, hey, dependent personality disorder is probably a thing or some version of it, they then believe, sensibly, providers will believe sometimes that you have to prevent the dependency from occurring. To which I go, think about human development. Think about the developmental episode on dependent personality disorder. If a big piece of their story is a lack of healthy attachments that engender a greater balance between dependency and independence, how in the living hell are we going to push someone towards independence if they haven't had the developmental steps necessary to encourage and nurture independence? A different way of saying it is these are enactments, right? Like part of the dependency, they're going to keep over depending on anybody that's in front of them that's a powerful being that's willing to withstand their dependency needs. And you, as an ideally relatively healthy attachment for them, you're going to see these enactments happen. And your job is not to panic. As I often say to students, your job is not to prevent the enactment from happening. The job is to do something different when the enactment inevitably occurs or recurs. So you allow attachment. One, you might not notice it right away anyway, so too late, they're already attaching to you. And number two, you are reparenting them in a way. You are modeling a healthy attachment that will initially provide a lot of support. And heaven forbid, it's a sciencey term, but psychoeducation, but a lot of what parents do for us is like, hey, this is kind of how the world works, or hey, do you notice this thing that's going on relationally? That's kind of curious. Like you're teaching them to observe and say like, hey, well, ground and observe, change over time episode. Like, hey, you're okay, it's okay, yeah, that makes sense. And hey, what are we noticing here? Oh, that's really interesting. What do we want to do with that? How are you going to do something? And you increasingly push on them and say, like, what do you want to do with that? What do you think might be the best decision? Or post-processing, like, ooh, that one really did sting or hurt. Where does your brain go after having experienced that? Did you notice anything that you're like, I might have missed that? And that's what we do with kids all the time. That's how we nurture healthy independence. Now, we can't handhold them forever. There's definitely deep end of the pool moments where you're like, you got to figure this out, go for it. But there's a lot of stepwise, like really getting them up to those points where they will jump in the pool themselves. They'll jump into the deep end by themselves if you just give them that little bit of like, wading into the shallows with them and teaching them how to float. They are far more inclined, particularly the healthier, higher level organization ones, to just start jumping in the pool themselves and boom, you've done it. You've done it. Now, a caveat here is really unhealthy, severely, psychotically, borderline level organization, psychodynamic language. Remember, lower levels of organization will overly attach, and you will have to start naming and confronting in the session more and more this tendency. And that is a lengthier process. So don't mishear me. It's not like easy peasy. You just scaffold a little bit and reparent them a little bit and they're good to go. But I will say a lot of cases will respond that way. Others, there's a little bit more of a delicate balance and a protracted sort of noticing of this. My personal approach is I'm never in a position where I'm not going to support. We all need a third eye in our lives. But after I've met with people for several years and there's a dependency vibe, I have to be particularly, pointed in pausing myself and pushing a lot of onus on them and or noticing when they're coming to me for too much reassurance. And not because they can't, but because that over-reliance, they need to observe and notice more so that they're replicating that less in other lives, in other relationships, in their life outside of therapy. Because the last thing you want to do, and where the fear of providers to let the attachment happen is merited, but it's too far ahead, is that they become so reliant upon you, in effect, they become more dependent. You've now taught them to seek out healthier people, maybe, but then they've over-idealized you and see you as, far too powerful, and then they will crumble without you. They will fail to launch yet again in their life. But there's so many steps before you get to that point as a provider. The fear of that happening gets in the way of people effectively intervening. So hopefully that makes sense. Again, that's a broad overview. There's lots of nuance in the how-tos along the way, but that is the goal. So so just to recap, we went through countertransference, how important that is to be aware of and to use and not shame. Number 2, be careful of gender dynamics, and that goes for both ends, being sure we're being fair and judicious and mindful and correctly identifying dependent personality disorder. And last but not least, like what's the process look like or sound like? And that is the allowing for some dependency as a conduit to or a catalyst towards actual growth of independence, noting that it can be a several-year process, to say the least. Oh, I guess I should make one final note. One final note. My apologies. I have the problem with me ad-libbing these things. Trauma treatment can absolutely be incorporated. I with personality disorders, I'm always hesitant to go straight to trauma treatment because I think what a dependent personality disorder will often do is they'll then offload and it'll use kind of the trauma processing almost in a way that could collude with a sort of weakness or frailty, like victim standpoint. And so, I think it's necessary because they've often been through a lot of trauma. If it's way severe trauma, start with the trauma work first. And then you'll notice if the trauma work actually heals them out of it or not. But usually there's still dependency that lingers after, but that allows you to access that more safely. If there's lots of light traumas or they really seem like they've moved through most of the stark post-traumatic like symptoms, if it's worthy of a post-traumatic stress disorder, you can start with personality work. And when you're doing and kind of confronting these tendencies, you're doing kind of exposure processing of the trauma work along the way. But just like I said, don't make a monolith out of these folks and suggest that dependency is just, a giant cultural issue. Do not solely assume it's just a trauma issue. And if you just, do some re-experiencing exposure, the dependency will go away. High-level neurotic folks, you won't know the difference, and you'll probably lead with trauma, and time will tell you if that will remain or not. But for the very severe, very pervasive, the ones that just out the gates, if you get more accustomed to treating dependency and your spidey senses are like, ooh, this feels awfully familiar, you got to do a both-end approach. Okay, now for sure I'm done, I think. Yeah, no, I'm for sure I'm done. So the greater question is, am I making another episode of this? I don't know if I am. I'll have to think about that. But this kind of rounds out usually the central ones that I talk about. Normally, like some sort of social aspect like gender would be next, but I collapsed that into an earlier episode. So yeah, I'll have to consider if there's anything else I would want to offer in the world of dependency. But no matter now, I'll end this episode and say, as usual, I appreciate everybody watching and listening. And as always, stay curious.